Guys, thanks for joining us. This is fantastic. Getting to speak to four leaders in healthcare at the top of their game is what the March Healthcare Classic continues to be all about year after year. And certainly this year is no exception to that. Four fantastic leaders of organizations that are at the cutting, if not bleeding edge, of the way that we think about providers in markets and in trends across the country. And so to get to spend time with each of you in each of your respective positions in your organizations, but also positions in the industry is absolutely fantastic. Cannot thank you enough. And I'm confident that this will be as entertaining of a conversation as we're going to have across all of the expert voices that we've pulled this year in RO3's March Healthcare Classic. Our task is a straightforward one here, guys. We're going to look across the full bracket, and I'm going to ask you just it's speed round for your thought around what's a hot trend, what's not. What are you looking for to go deep in the tournament? What's not? And then we're going to dive right in to your particular region of the bracket, the providers, and what those 8 trends either mean to you at your organization, what you think they mean to the industry, and what does that look like. But before we do any of that, let's go around the horn. A quick intro, name, title, organization would be great, and then we're going to get after it. John Herman, I'm looking at you first. Why don't you kick us off?
Hey Josh, thanks for including me. John Herman, I'm the president of Tufts Medical Center up here in Boston.
Lee?
Yeah, hi Josh. Lee Handke. I'm the CEO of the Nebraska Health Network, and we are an accountable care organization based in Omaha.
Matt?
Matt Hanley. I am the president and CEO for Northeast Georgia Health System, just north of Atlanta.
Not to be outdone, the OG of the March Healthcare Classic, been with us since the beginning, Eric Gallagher.
Thanks, Josh. Glad to be back, combining two of my favorite things here with healthcare strategy and March Madness. So Eric Gallagher, I'm the CEO of Ochsner Health Network and lead our value-based care and population health platform here.
Eric, you get first dibs here. Lead us off. Show us how it's done. When you took a look at this year's bracket, what were your impressions? What did you think? Were there trends that popped out at you? Athletes that you felt like were stronger or weaker than others in any of the regions? Before we dive into yours on the provider side, what were your reactions?
Yeah, I think one thing that stood out to me across the bracket, a lot of these trends around AI, GLP-1s, consumer engagement, payment models, they're really all trying to answer the same or very similar underlying question, and that is, how do you manage cost and utilization without breaking access or the patient experience? So they all come at it from different angles, but it's kind of the same pressure that's driving that. I think it'll be exciting to see. A lot of these look great in the regular season, but which of these trends, really able to travel here in March? And then, one thing I'll say, I think every tournament needs a little bit of controversy, and so I'll just jump right in. And I was a little surprised not to see this, CMMI or the LEAD program make the field here. It certainly, as we film this, there's a lot of chatter going on across the country about that program, and maybe early for 2026, and they may not be ready to make a run until 2027. But I thought that might be, maybe the biggest snub of the bracket.
Yeah, they ended up in the RO3 March NIT Classic, but certainly recognize that the potential that you think that holds. Matt, would you see it any different when you think about the bracket as a whole?
Yeah, there are a lot of good players here, and if I go around the horn, you look at the purchasers and the plans, and this is the first time in a long time that the plans have been under pressure, right? Negative margins, and they're trying to find their way in a time where I would say last half a decade at least they've had their way with us. And so the innovation and what they do under pressure, whether they retreat, whether they advance the at-risk models or not, will be, to me, very interesting. Actually, if I go over to policy, I just think that the shoe still has to drop on the one big beautiful bill next year, and if there's one thing that if there's one big shadow that's sitting over, on the provider side, it's the one big beautiful bill. And what is that actually going to mean? And have people made enough provisions to be ready for that? And do they have enough margin, to absorb that or not? And then, I think about the Pioneer side, a lot of good stuff going on there. And my question is, who is gonna, who is going to really, really disrupt some of our care models, like in such a meaningful way that there's no way we can go back, right? I'm a little bullish on this home-based care piece. It's sort of survived the COVID era for another round or so, and there's some players doing it at real scale. So there's efficiencies being gained, and like, listen, who doesn't want to stay at home? And then I think at the provider side, I mean, the providers, I think, I think it's all about performance under margin. How do we continue to do what we need to do and still be able to reinvest, moving forward and transform? But no, I think this is the field. I didn't see nothing struck me as any real big miss for players. Yep.
Love that. It means the seating committee got it close to right this year, perhaps. Lee, you see this similar? You see it any different?
Yeah, I think you agree. You got a really strong field here. The team that's really popping out to me is over in that provider and plan region. It's that 3 seed, Josh, the value-based care enters the prove it era. Now, I'm probably a little biased because I'm, accountable care and working value-based care, but it's kind of like that Illini team, coming in pretty strong, a little under the radar, probably can make some upsets there. What we see in value-based care is it's totally changing. Fewer upfront support payments for health systems to get this figured out and hit an era of success. CMS is even changing the game. I think they've kind of brought a fail fast mentality to it, as we've seen them take programs like primary care first away and quickly innovate to new programs, and we're seeing that on the commercial side as well. So I think we are at a time where it's like, let's make sure this is the right thing. Let's prove it. And even in that same region, when we're talking about employers and benefits, and they're paying for some of these value-based programs, they want to say, prove it to me that this is better for my employees and their care. And then across the other brackets, I think there's a lot of things too that just support value-based care, proving it. It's home care, it's transparency, which I think over there in the policy as a 4 seed, I think we're going to see a lot of advancement there that'll help employers navigate cost-effective healthcare. And then certainly back into our region, when we talk about AI and enabling care, all of that rolls up to success in value-based care as well. So I would say you guys might have underseeded that one a little bit and look for them to make some noise in the tournament.
Love that. When we get to the purchasers and plans experts, I'll let them know that 3 seed maybe could be renamed the Fighting VBCs, so that it matches your Illini analog there. I like that a lot. John, Herman, not to be outdone, what's your macro view here when you look at the whole bracket?
I agree with a lot of what my colleagues said. I think by far we're in the strongest region. I mean, the things that are going to impact us or determine our success over the next year, the teams that are in the provider region are definitely key to whether we're gonna see 2027 or whether we're not going to see 2027. But I'll say there's a couple things in the purchasers and the policy that I think with all of the challenges that are happening in the economy, because of either the federal government or the impacts that the federal government's having on the economy. I mean, who knows what the employers are going to do? They're going to have to do something dramatic. And I think in the purchaser plan area, those two employer things, whether they're going to renegotiate their benefits plans with the payers or whether they're going to go direct, like they're going to have to do something in order to maintain their margin. And who knows what impact that's going to have on us? But it's going to have an impact on us. It's just not something that we control. I was a little bit surprised. I mean, the federal government is like 70% of our revenue, and I was a little surprised to see that Medicare Advantage was as low as it was in the rankings. I mean, that's a powerful powerful team historically. And, if there's major changes there, I think it could be a real boost for us, or they could just be a bust. So who really knows what's going to happen there? And then, I mean, at least for me, my whole margin's on 340B. My whole margin is on 340B. And if the federal government or the pharmacy groups over in the policy group, if they mess with that, all bets are off. All bets are off. But I'm going to go back to, I mean, you have to focus on what's in your control. I think we definitely have the strongest region, and I think one of the winners is going to come out of our region.
So stick with it, John. Stick with the provider region. Let's go a little bit deeper here. When you looked at these 8 trends, before we look at matchup to matchup, when you looked at these 8 trends, what are 1 or 2 that you just either you were surprised by, or you felt like this is just spot on. This is a team that's going to go really deep.
Yeah, I mean, I'll start with cybersecurity. I looked at that as a wild card. Like if cybersecurity has a direct impact on us, like they're going to win. Like there's nothing that we can do there that won't determine whether we're going to be successful or not, just because we don't have the controls in place in order to counter the strength that cybersecurity can bring to our business, or the adverse impact that it can bring to our business. But I will say, fortunately, a lot of us have been relatively protected from that. But that's the wild card. Like if in our region, if they get hot, if they bring their A game, I think all the other teams are in trouble. I would say though that the thing that I think the thing that I think is strongest, and the thing that we need to continue to pay most attention to, is our performance under pressure. How are we going to react to all these external things, and how are we going to manage our business in the context of the revenues that we have and the expense base that we have? And that's core to any winning team. You just got to have a good operating plan. You got to have a goal of what you want to do, and you got to stick to your plan. And so that's how I'm seeing this bracket. Is it's going to come up to either somebody's going to get really hot in the cybersecurity area, or the performance under pressure is going to win it.
Eric, what jumps out at you here on the provider trend side as you looked at the 8? Is your perspective consistent with John's? Do you see it any different when you think just at the 8 seeds top side?
Yeah, I mean, I think at a high level, it's consistent in that I think it's a really strong bracket. To me, this is the most, blue blood region in the whole bracket. Because these aren't hypothetical trends. There's not a lot of new ones. These are teams, trends that are easily recognizable. Several of them kind of been around for a while, so I'm not seeing a lot of Cinderella. More, teams that are in the tournament every year, and they're being asked in 2026 to prove if they can win. I think we see, a few that are about improving the current system. I think we see a few that are drivers of change, and forces, and then we have a few that are, um, you know, kind of changing the entire operating model of healthcare. And so, what's always interesting is that, certainly if I was any good at this, and if all of us were any good at this, healthcare would be a lot better in our country at predicting what's going to happen. But what's interesting is what plays out in that year. There's a lot of big headlines that drive what people expect to be the biggest trends in the year. And then, the real reality and what's realistic to actually hit an inflection point or really be a driver of change in the year is what I think we're going to be talking about when we get to who's cutting the nets at the end.
Love it. Lee, let's hear what you think.
Yeah, there's a lot of solid teams here, Josh. But for me, I got to understand the players on the team to understand their ability. And the one that has just a lot of players and some very familiar to me is that aging demand crunch. So there's millions of players on that team now in this country. four of which are my parents and my wife's parents. And I see, a lot of what they do is they're going to physician visits or they're going for screenings or other care. And I think about that compounded, and it's not just a demand issue, as just a demand in aging, but it's also the acuity of those services. And then you think about the weight of the system of that, and then where does that leave us? Well, I just called for a primary care appointment the other day, and it's a month and a half for me to get in. And so you start to think about this further taxing already precious resources. Who has time to do prevention? And so that's one that I think is definitely maybe underrated. And then a little bit in line with what John said, cybersecurity. I mean, how do you even seed that? Because wherever you seed it, underappreciates the risk. And I think as we move into models that are more digital, that are more dispersed, those risks become even greater. And so that one is one. If you have a cybersecurity issue, everything else stops. And so it really has the potential to really make some noise, really across healthcare and other industries as well.
Matt, happy year anniversary, by the way, this week. Happy year anniversary to you. As you've spent your year, do you see these trends, these 8, any differently than your colleagues do? Do you feel like there's another one or two that jumps out at you a little different?
Yeah, maybe a little bit. I'm going to go back to just what I think are sort of fundamental blocking and tackling. And, the number one seed AI, I feel like that's probably a lot of hype there. I mean, I was spent the morning up on the floors with some of my hospital's physicians, and listen, we are still in a people business. And I was just thinking to myself, there ain't no amount of AI that's going to fix some of the problems we're trying to fix today. And if there is, it ain't going to be next year. And so I like blocking and tackling, and I think the crux of the thing that we need to solve that will give us oxygen on a lot of these fronts, whether it's with the employers, the purchasers, the policy, care innovation, is we got to figure out how to wean ourselves off this HOPD model and really focus on ambulatory outpatient expansion and create new business models and figure out, like, the business model and how our cost structure is a lot lighter moving forward. And so, to me, that's deeper investment in the clinical space and the clinicians, less investment in big, beautiful buildings and stuff like that. That is nice, but at the end of the day, is not directly contributing. So I really feel like the 2 and 3 seeds are really strong. I agree with the 6 seed. That's part of what's in front of us right now. And as far as the 7 seed cybersecurity, a lot of conversation around that. Listen, there's always an upset, right? There's always an upset in the tournament, and the 7 or 8 seeds every once in a while have their day in their day. But I think long term, it's the stuff I said before.
Let's have you keep the mic here for a minute and opine on the 1 versus 8 a little bit further. AI becoming the new clinical infrastructure versus prior authorization revolution. I could almost make an argument that these might be 2 sides of the same coin. If you were to soften the pre-authorization hurdles, perhaps then it gives you access to what now should be a potential real force in your care team, and that is the leverage of AI to be able to help triage you in whatever point of care you need to be in. Given the fact that you've got entire business models, companies focused on each one of these 2 significant trends in the industry now, how do you rationalize one versus another? What stands out at you, Matt?
Well, I'd start off by saying it's just a real shame, isn't it, right? Because this is an incentives problem, and prior auth is what I call a big rock in the shoe that I think a lot of us are going to use AI to solve our rocks in the shoe. But I think about my days in working in a fully capitated system. Um, all of that stuff gets to go away because incentives are aligned, and you get rid of the stuff that's completely non-value added. And so I think, yeah, listen, we there are companies who are coming up with prior auth or denial software that's going to automate it. And basically, it kind of feels to me like we're hitting the tennis ball back over the net, to the payers. The real thing we need to do is, I think about the macro incentives and how, this is to me the biggest, a huge waste of resources, time, people, administration. And if we could somehow reallocate this back, this responsibility back, the stewardship of the resources back to the right level with the right incentives, we'd go a lot further. But I don't think this is new in the basketball world.
Yeah, and AI being a part of the clinical infrastructure felt like it was a number one with a bullet. It was just too hard for the seating committee to turn away from it. Eric and Lee, you lead two of the most mature value-based organizations in the country right now. When you think about the implications to how value is thought about through these two seeds in particular, how do you think about this kind of matchup? Eric, let's start with you.
Yeah, I mean, I think Matt said it really well. And in my view, prior auth revolution or reform, it's absolutely meaningful. We absolutely will do every day and would feel it in our operations. We definitely want fewer delays, fewer manual touches, better flow, patient flow. But ultimately, I mean, I think it's incremental, right? It's all about prior auth reformations, all about improving the friction within the existing model. And to Matt's point, like that's a messed up model. It's not fundamentally changing how care is delivered. And so, good team, well coached, cleaned up, no turnovers. But I think, to contrast that AI, I mean, this is a team full of NBA draft picks. It's a headline story in a lot of ways. I think it's one of the most exciting things happening in healthcare right now. The level of investment that we see, the number of use cases that are growing daily, the speed of adoption. And I do think that, in our environment in 2026, we've moved past the pilot phase. And we already bought the things and deployed the things and tested the things. And I think the question now is starting to become much more practical. And does this reduce documentation burden? Does it improve clinician productivity? Does it expand access points for our patients and improve throughput? Because if it doesn't start to hit those things and prove that, it's going to be really hard to justify scaling it. And I think we are going to start seeing being able to answer that question in 2026. And the most optimistic view is that AI becoming the new clinical infrastructure is going to answer a lot of the questions posed by some of these other trends across the bracket.
Lee, you see a line through there to figure out any different commentary? Do you feel like where Eric and Matt are going here is the right path?
Yeah, Eric said it well. There's a lot of lottery picks on that team. So they're a hot team right now. They're a one seed. Here's the problem. They're all freshmen. They haven't really been battle tested yet. And when I think of, how you use the word infrastructure here, when I think of infrastructure, I think of something that's predictable, it's reliable, it's interoperable. And what I've seen in AI from personal experience, it's just not there yet. So we have an issue, I think, with data silos still that'll prevent its full use and adoption. We have a trust issue. I use AI a little bit and I've seen errors. You guys probably have as well. And so those freshmen, I think when they get battle tested, they could have some shaky legs. So it'll be interesting to see how they perform. Now, I think they have a fairly easy matchup in round one with the pre-auth revolution. That's something that the technology's been there. I think if we have good access to diagnosis and drug history and biometrics, all that should be automated, right? So that leaves me with the question, the coach of that team, the payers, do they really want it to be automated? Or is the hurdle and the friction part of the effectiveness of pre-auth in the first place? And so that team might be running in two different directions. And so I think AI can get the early win, but long term, I think they need a little more experience.
Yeah, I love that. John, do you see do you see a path here? Where do you feel like the 1-8 are? Do you feel like it's all been said, and you really want to hone in on the two areas or two of the areas I know you're interested in, that 4 and 5 matchup?
Yeah, you know what? This was one of the most interesting games in the bracket for me, and part of it's because I'm up here in Massachusetts. The thing that many don't may not know is here in Massachusetts, the governor has decided that she's identified a set of conditions that she wants to force the payers just to cover. No pre-authorization. They have the condition, the order goes in, you just get the services. And so if that gets through the legislator, like prior authorization's got the winning team. There's no doubt about it. There's no doubt about it. So this game, it's either going to be a dud because none of them are going to be able to do anything, or it's going to be triple overtime, or one of them's going to crush the other. Like I have no idea what's going to happen. Um, but I mean, I'm in a city of academics that have we don't have enough capacity. And there's some tools that are being floated around the region about how do we use AI to get the right patient to the right provider at the right time and release a bunch of that capacity. And I mean, if AI is able to do that, they're gonna crush the pre-authorization unless the governor gets that through the legislature, and then it's gonna go to triple overtime. I don't know who's gonna win.
Well, let's then turn the attention to the 4 and 5, and I'll be particularly curious here. We'll go John and Matt before we go to Lee and Eric, for you to hear, or for us to hear about how you're thinking about the hospital at home 5-year Medicare waiver extension. Over 400 approved hospitals now in almost 40 states, numbers growing. But certainly a breath of fresh air for business models out there, either within health systems or even those that are stood up on the side of them. That at least that extension got finalized. So that's certainly one to keep watch on. But it really feels like we might be 5-4 here. The workforce challenges can't be overlooked. The numbers are increasingly staggering over the next handful of years, and what we're looking at, and it's created different types of care models, different ways for us to think about integrated team-based care delivery. And I certainly know that Tufts in Northeast Georgia are thinking about that. So, John, how does the 4 and 5 matchup sort of look to you?
Yeah, again, I'm probably speaking a little bit from the context of Massachusetts and Boston and a bunch of academics. I think the 5 has a line for us. It feels like I'm dealing with portal and NIL dollars like all the time, like all the time. People are just moving around. It's free market, and then I have to pay them more in order to get them to come. I mean, hospital at home. It's an important thing, but for me, the number 5 has it here.
Matt, what do you think?
Yeah, I mean, I think I agree. I feel like the hospital at home hasn't been in the tournament enough years to be considered a legitimate contender. I mean, I think when you think about hospital at home and you remember, I mean, first it's all about scale, right? To hone the business model. But the second thing is the aside from the higher level satisfaction that patients have, the premise is that it's going to cost less, right? But what happened when the thought about the waiver got pulled out, right? And everyone, a discount rate, everyone got cold feet and began admitting all those patients in the hospital. So yeah, we're doing it, but we haven't really been innovative in changing the care model such that we can change the reimbursement model. And so until they figure out that offense, I'm always going to be a little bit on the fence for that, for the hospital at home number 4 seed. I think workforce challenges, they've been here for a long time. They continue to be in our face, and I think we got to continue to use that as a catalyst to think about how we care about people differently. And there continues to be some protectionist mentality in different areas, but I mean, listen, all of the, all of these coaches here have gone up, been around long enough to see care models changed significantly in terms of what they can or cannot do. And so I think I'd put my money on the 5 seed.
Lee, what do you think? And then we'll go to Eric to close out the perspectives on these two teams.
Yeah, I think, the word mainstream here on hospital at home to me is a little premature. I think more health systems are involved, but the overall penetration in the market's still been pretty small. The tech issues have been solved, the broadband issues have been solved, but what hasn't is probably the workforce, which is, the 5 seed here. And so, if you want to grow your hospital at home program, you have to make intentional choices, probably hit the transfer portal and bring some of the workforce that you're deploying centrally into that hospital model. And I think with the workforce crunch, it probably limits the uptake and exposure of that. So I'm for sure, putting my money on this one on that 5 seed. I think they're going to do real well.
Yeah, I particularly appreciate the call out, Eric, that Lee just made of the technology piece. In some markets, that certainly the broadband issues have very much so been solved. But then you've got a number of rural markets like exist in some of the parishes in the outskirts across Louisiana that we're not just at broadband levels, we're at dial-up levels. So to be able to deliver hospital at home, it still requires not just technology, but the workforce that Lee called out well. How do you view this matchup, or do you feel like it's all been said and you really want to dive into the aging demand crunch versus ambulatory?
I'll add a couple of things. I think unlike Lee, I'm not putting my money on either of these teams. In fact, this is probably one of those early weekend, or early round games, weekday games where I'm probably turning the TV off. That's workforce. I think this issue is obviously critical, but for me in 2026, it's not a real differentiator. It's really the constraint that every organization is dealing with, as everyone's talked about, the shortages, burnout, pipeline issues. That's become baseline environment, and I've been tricked by this trend in years past, and I think it's there every year, and it's just not a winner. I don't think it's gonna change drastically in 2026. And so, not that excited about it, and then hospital at home, I agree with a lot of my colleagues as well. I'd say, there's probably a little bit of a branding issue on hospital at home. I do think that, there's opportunity if we start thinking about delivering acute care at home more broadly. But right now, hospital at home, it's not a broad replacement model. It's a pretty specifically defined extension of capacity from hospitals. It works for certain DRGs, for certain acuity levels, for certain patient profiles, and when those conditions are met, it works well. But it's an experienced, unflashy team, and like I said, I think for both of these, not that exciting all around.
Then hang with me for a minute on the 3 versus 6. When the seating committee handed me the seating this year, this is one that hopped out immediately as not only a potential upset, but as two trends that feel like this year have real potential to impact the way we think about the way care is delivered, managed, and coordinated. You've certainly got CMS's attention on the ambulatory and outpatient side, where this administration has now got multiple models to be able to think about ambulatory activity and outpatient and access challenges that we're solving for. But the aging demand crunch, 1 in 5 of our population moving towards 65 and over the course of the next handful of years, a population additionally, when you layer on the polychronic and multi-chronic condition set, sicker populations with disease burdens that need to have the workforce that you just described to be able to tackle. And that's a challenge in and of itself. Are you seeing the 3 and 6 kind of the direction that I'm headed here? What kind of uniforms are we looking at? What kind of coaching? What do we got here?
Yeah, I think the aging demand crunch, if you will, it's kind of like a Gonzaga. It's going to be in the tournament every year, and we're gonna be talking about it and seeing this in the tournament every year. But it might also be a bit like Gonzaga, as in maybe a run here or there. I think it's not a 2026 trend that wins the day. It's absolutely real. It's absolutely driving a lot of what we're talking about in the bracket, but it's more like a macro force that shapes the game, right? It's like it's the crowd noise. When you walk into the arena in March. Um, but for me, I'm looking more at the strategies that we might deploy amidst all of these other pressures, and so when we turn our sights on the ambulatory expansion. I mean, to me, this is probably one of the clearest strategic moves in the region. If you're making capital decisions right now, the math is pretty compelling. Lower fixed cost structure, faster throughput, more convenient and better experience, better access for patients, and then better alignment with where payers want care to move. So, I think it's accelerating because of a lot of, we haven't talked about the margin pressure yet, but this is one that's accelerating because of that, because of the aging demand crunch. And I think it's a team that's not flashy, but it's highly efficient. The last thing I'll say really is that the volume from the aging demand is coming either way. And I think the question is whether you're capturing it in a way that's going to actually work financially or not. The old way doesn't work, and ambulatory and outpatient expansion is one of the answers to how it might work.
Matt, you and the NGHS team are certainly making bets here to be able to tackle trends like the 3 and the 6 here. What feels like it could go deeper in the tournament for you?
Yeah, I mean these are two gritty teams, right? They're always so in the mix, and one of them always makes a bit of a run every year. The other thing about the aging, to sort of in addition to what was said, is that there's a frailty, just a fundamental frailty consideration and social consideration with a lot of the aging population that almost supersedes the chronic disease. It's, in other words, they're chronic, and with a little support, they would be fine at home or by themselves, but we don't have the support. And so they are not at home. And then that's it. And so that weighs heavily in a lot of communities across the United States and is a real resource, hog, and that's not going to go away. But it's not going to be like necessarily a tidal wave this year or next year, but it's just going to keep just like the tide comes in and comes out. It's going to continue to do that for a while. But to me, the ambulatory and outpatient expansion is all about innovating the care model, as I said before. And the more successful we can be in disrupting ourselves, rather than trying to ride a dead horse, I think the more possibility and the further that 3 seed is going to go.
John, you feel any different than what Eric and Matt have said here when you look at this matchup?
No, I think I'm pretty well aligned with them. I saw this as my North Carolina Kansas game. Like who's going to go out in the first round and who's going out in the second round. Now, hopefully, if we're in the first round, we're not going to get fired because we messed it up. But I mean, these have been on our playbook for 20 years. I mean, we've been talking about this for 20 years, and in order to do anything in this space, although relatively speaking, all of these are heavily capital investment intensive, and all of our margins are under pressure. Our balance sheets are under pressure, and it's just like who's going to go out in the first round, who's going to go out in the second round? Because I think that there's other teams, there's other issues that are hotter, and that's who's going to advance in the tournament, and that's who's going to advance in what we focus on in order to ensure that we have an opportunity to get back in the tournament again. That the university doesn't decide to close down the program, and so I think these two are going to be slogs. One's out in the first round, one's out in the second round.
Lee, round us out, and then we'll hit the last trend here.
Yeah, just quickly, that outpatient team, we've seen them grow over the last few years. I think that's going to continue. It's been good for system growth, but more importantly, it's been great for patients and access, which I think is the most important thing. The challenge is, I think the NCAA is looking at a rule change. I thought it was going to come maybe this year, but it could be, as big as a 3-point line, and that's site neutral payments. And so I think outpatient growth and use in the future has to assume lower reimbursement over time. So it'll be interesting. I think they might be good this year, but look out in future years. And then my feeling on the aging demand crunch. I said it earlier. There's just so many players on that team. Every time out, there's a new 5 coming in, and they all have their different skills and issues that you're trying to deal with. And so it's kind of like putting your finger in the dike and hoping that you can just claw to within 3 points to get you a final shot. So that I think aging demand's probably gonna do it this year.
All right. Well, that brings us to the 2 versus 7. I thought this was a really compelling matchup. Cybersecurity is a clinical priority. John, we'll start with you here on this because of one of the points that you made earlier. This is a risk that's difficult to measure, especially given what the seating committee put on this as emphasizing the clinical side. No longer just an IT risk. 70+% of cybersecurity breaches around the country have now been shown to disrupt patient care at some level. So when you think about that versus the margin pressures that you've referenced a couple of times that you have to be able to perform against, just north of 1% margins across the country at the end of 2025, and perhaps no signs of any improvement as we move into the first full half of this year. What do you look at the 2 versus 7? How do you jive these?
If the NCAA Player of the Year cybersecurity makes it through the tournament, like if he doesn't get hurt, they're going to win it. But if he gets hurt or doesn't perform the way that we would expect him to, I think it comes down to, you've got this rock solid group of 5 or 7 players that are just there like every single day, and they make their threes, they make their free throws, they're good at boxing out. Like, man, that's the way to win. That's the way. There's a lot of championships that have been won that way. Solid defense. I think we've got a couple teams in the tournament this year. Solid defense with a couple good shooters. And I see the performance under margin, the one that's gonna, they're gonna go far if they don't win it.
Lee, what do you think?
Yeah, I tend to agree, on the performance under margin pressure. That's driving teams to look at consolidation and innovation both. And there's an up and a downside, I think, when it comes to healthcare there. Sometimes consolidation leads to higher costs and not as good quality. And so, those buckets aren't always falling. But innovation certainly, I think, could win the day if they have the right strategy. On the other hand, cybersecurity to me is kind of like a trump card again. If something happens there, all the rest of this stuff, you lose your attention on it. You really focus on that issue. And for me, the cybersecurity team is all about defense. And the best defense still, I think, is just individual awareness. So most of these breaks come because of spam or individuals. And so I think it's just really they got to focus on that defense and making sure that the entire team is aligned to stop that. So it'll be interesting to see how that plays out.
Eric, what do you got?
Yeah, this is a slow pace game. And Lee said it well. I think on the cyber side, this is the best defensive team by definition in the entire bracket. And it's increasingly important. Yeah, especially when we talk about clinical risk. But fundamentally, it's still defensive. It doesn't create forward performance in the same way that I think some of these other trends do. And on performance under margin pressure, this is probably the least exciting trend in the bracket, but the most important, or at least in our region, but the most important trend happening in our region. I think it's the environment that every one of these other trends is operating inside of, and likely just mentioned on innovation, on consolidation. The reality is we got a really unforgiving set of dynamics at play right now. We got labor costs that are really high. We got reimbursement that's not keeping up with inflation. We have higher acuity, more utilization in our Medicare population. The payer mix, certainly in our market, increasingly government heavy, and that's all real. None of that's theoretical. We are dealing with that on a daily basis. And so, margin pressure, it's forcing this level of discipline around capital allocation, service line strategies, the pace of execution. So I think, what's different in 26 is that the tolerance for strategic but not operational is very limited. We've had years in the past where provider organizations could experiment, try things, invest ahead of return, and that window is a lot smaller. So I think because of this margin pressure, you're seeing things that we've talked about: accelerated ambulatory investment, more scrutiny on AI, and even across the bracket, tighter partnerships with payers, exits and consolidations, because it's all being filtered through that same lens under margin pressure. So, this is going to be, I think, a really good team that's going to go really deep.
Matt, give us the final word here.
Yeah, I mean, John, if that previous bracket was your UNC Kansas, this is my, and it pains me to say it, my Duke UConn bracket. And listen, cybersecurity, if you make that, lucky shot at the end, you're gonna go forward, and you get knocked out of the, and on the flip side, you get knocked out of the tournament. If we played a series of 7 games, I think performance under margin is going to win that series every single time. I think, in addition to what everyone else said, I really am waiting for the shoe to drop on the one big beautiful bill. I mean, like you mentioned, margins are super thin. We're in a world of have and have nots, and health systems. Over half the health systems in the United States have 0 to negative margins. That's not going to make it easier. And so I think the premium on figuring out your operating model is going to be huge, and I think they go deep.
Guys, can't thank you enough. Speed round, John, is the tournament winner in the provider side of the bracket.
Absolutely.
Matt?
No doubt.
Lee?
Yeah, no question.
Eric, is the tournament winner on this side of the bracket, do you think?
I'm not going to go against these great experts here, and I'll agree with all of them.
Guys, thank you so much for joining us. It was terrific to hear, as always, your 4 expert perspectives around the direction that providers are headed this year, but most importantly, what folks at home need to be thinking about as they're advancing their March Healthcare Classic brackets. Appreciate your time, each of you.